Hello everyone, my name is Shauna Aranton. I am presenting an article critique on ethnography. The research article that I selected is called A Qualitative Systematic Review of the Factors That Influence Prescribing Decisions by Nurse Independent Prescribers in Primary Care. And while not a true ethnographic research and primary research, it does use meta-ethnography to be able to answer the research question, which their research question was, what are the factors that influence independent nurse prescribers' decisions in primary care in the UK? So the purpose of that was to help understand what factors influence the prescribing decisions for independent nurse prescribers in primary care so that the practice and service can improve to ensure safe and effective patient care. So briefly, a brief background of nurse prescribing privileges in the UK was discussed. The search using databases and websites between May and July of 2016 using CINAHL, Scopus, Ovid, Nursing Database, and several others, as well as the reference lists and that they noticed from papers and key journals. They used that to conduct their research. And then these 7 steps of meta-ethnography were used from an interpretivist lens, and the findings resulted in 3 main interpretive themes: perception of competence, perception of risk, and impact on the patient. So methods they used was the literary research, right? And they had inclusion criteria, exclusion criteria, and terms and synonyms. And then the 7 steps of meta-ethnography was used, which consist of getting started, confirming initial interest, reading the studies, determining how studies are related, translating studies, synthesizing translations, and then expressing the synthesis. And they did come up with 3 themes. So perception of competence, perception of risk, and impact on the patient. And this was so that they can understand that appropriate education and training are pivotal for improving nurse prescribers' competence, reducing risk, and preventing patient harm. For implications for this study, they believe that, employers, based on this study, employers should be providing specific training to nurse prescribers. And it also recommends that future research be conducted because there was barely any research on this. And so we really do need more research exploring primary care nurse prescribers' experiences. The strengths of the article in terms of ethnography, the focus was clear. And the purpose was clear. The methods that they did use a validated tool, right? The validated methods of the 7 steps of meta-ethnography, which, stated, and they did state how consent was not necessary because it was literature review essentially. And they did study the patterns of the nurse prescribers' decision making, which is something that we see studying patterns, as far as culture. Sampling, the reason the nurse prescribers were selected is clear, right? This was the reason why was this researcher. That's her field of interest is primary care. And so she really wanted to understand with guidelines that were changing in the UK, what is going on with these nurse practitioners in primary care. The data collection was solid in terms of, validated resources that they used. They used the Epi Reviewer for software and codes that represented their selection criteria. They extracted data as far as the time frame that was, a lot of the studies, some of the studies had over 3-month interviews over the course of 1 year, so it had the time length that the study was looking for as far as ethnography. Verbatim quotes from participants and original research interpretations were used to kind of enrich it. Analysis, again, they use the software such as qualitative assessment and implementation methods group and the 7 steps of meta-ethnography, so that they can be able to understand the theoretical understandings of the phenomena and its relation to clinical practice. And as far as rigor, findings, and conclusion, the confidence in the qualitative synthesized finding tool applied to the findings to assess the overall quality of the evidence and determine its reliability. And they presented the findings in a systematic way, right? The themes that we talked about, the 3 themes, and they did recommend, direction for future research. So that was strong in terms of ethnography. As far as limitations, the methods, when you're reading about ethnography, they're conducted in the field, right? Research is conducted in the field over a long period of time. So this was not done that, and it wasn't really primary research. Sampling, Only 3 journals were included, mostly due to lack of current research on this topic. And so you think when you hear the term meta-ethnography, you think that there'll be more than 3 studies researched. So that might have been a limitation. As far as collection, some discussion topics were missing regarding like the studies in terms of like, enrich or in-depth observations or artifacts or things that were used in those original studies that were evaluated. That would have helped bring a little bit more idea to the culture. As far as data analysis, there was reflexivity was missing during the analysis portion of it, so there was no discussion regarding that or throughout the whole article actually. And then rigor, findings and conclusions, limitations, they really didn't discuss how they maintained objectivity, and they weren't, like I said, the findings weren't really presented in as rich of a format to give a really good feel of the culture. So in conclusion, while this article is kind of along the lines of my research topic, it really isn't, because it doesn't talk about perimenopause or menopause. And it was really particular to UK, which, they have very different prescribing privileges and, qualifications for nurses to be able to prescribe there. So different training, things like that. But, it does kind of hone in on where I did want to talk about how, specific training can improve practice and patient outcomes. I did use, this is the only thing I could find in regards to like something's either general enough as far as prescribing decisions, or, nothing specific enough for perimenopause or menopause. In terms of ethnography, like I mentioned, it wasn't a true primary research, and so it didn't really give that rich feel of the ethnography and like talking about culture and things like that. But like I said, research is so limited in this topic. It did help me understand, though, the 7 steps of meta-ethnography, which I thought was interesting and an easy stepwise approach. And as far as critiquing, I used the qualitative research and nursing book to help me use it as a checklist to evaluate this article, which is really helpful on box 10.1, and it really helped me break down this, even though it wasn't a true ethnographic study. It helped me at least analyze and critique it and find out how it related to that. Here are my references. Thank you for your time.